Hello everyone. Today I'll be discussing the timing of cleft lip and palate treatment. The treatment starts right at prenatal stage where USG diagnosis is done. The referred to cleft team. Next, in the newborn period, when the child is just born, reading assessment is done, followed by medical evaluation of other congenital disorders, newborn hearing assessment, caregiver counseling, and genetic referrals are done. Next, during the period of 0 to 3 months, nasoalveolar molding is done. Along with audiologic assessment, this is done if the newborn screening is abnormal. Next, during the age of 3 months or on following completion of nasoalveolar molding, primary cleft lip repair along with primary nasal tip rhinoplasty is done. Along with that, gingivoperiosteoplasty is also done. During the period of 9 to 12 months, primary cleft palate repair plus placement of myringotomy tubes are done. Next, we come to 12 to 36 months period, that is 1 to 3 years. At this time, pre-linguistic speech assessment which is done if the child is less than 2 years, formal speech assessment, which is done if the child is more than 2 years for diagnosis of velopharyngeal insufficiency. Next, we come to 3 to 5 years of age, where secondary speech surgeries are done, like surgeries for VPI. During the school-aged years, revision of secondary deformities of cleft lip and nose is done. Next, we come to 7 to 9 years of age, where alveolar bone grafting is done. Period of adolescence, that is 10 to 19 years, where first stage orthodontics, revision rhinoplasties, are done. Next, we come to the period of early adulthood, when there is skeletal maturity, 16 years for female and 18 years for male, where orthognathic surgeries are being done. This includes Leaford 1 advancement plus minus mandibular osteotomies. So this is the timeline of a cleft lip and palate management, and this is amongst the most commonly asked questions in theory, and also parts of it may be asked in Viva. Thank you.